All right, then. So let's go. Today on the program, Nigerian Medical Association, NMA, says only 24,000 doctors are left in the country, just as the doctor-patient ratio stands at 10,000 patients to one doctor. As I just said, I'm hanging out with Babajide Kolade Otitoju, that's BKO, and Theophilus Abba. Theophilus, I greet you. I haven't seen you before, but welcome to the fold.
Okay, good evening, sir. I thank you for the opportunity to be here.
Yeah.
I've been a journalist for more than 20 years now.
Okay.
Yes, and Babajide was my boss.
They say it's a thankless job, but it is not.
Of course, it's a thankless job,
Oh, really?
but because the kind of wealth that others make in maybe other professions, journalists don't get to make them. But if you're a journalist, it's like you are indoctrinated into a world of making investigations, searching, and all this and all that. So, and you don't easily leave journalism.
Yeah,
there are not many journalists who left.
You are either born a journalist or you are not.
You are not. Yes.
Great. Okay. But the thrust of what we have today is heart-rending.
Yes.
24,000 registered doctors practicing in the country of 200 million people.
Well, it is quite pathetic, and I want to say that some of the discussions or my contributions to this discussion tonight is actually based on a research we did in partnership with Development Research and Project Center. It's based in Abuja. They've been doing investigation research into issues of health, education, policy issues and development issues. And they have funding from Bill and Melinda Gates. I am of the Daily Trust Foundation and the program director at the foundation.
Okay.
Daily Trust Foundation is an arm of Daily Trust newspaper. We call it Media Trust Group now.
All right.
But it's a not-for-profit arm. And we do humanitarian activities, including health issues. And then we do research and we do investigation. But in this case, we partnered with Development Research and Project Center in Abuja, who have funding from Bill and Melinda Gates to talk about issues, data related to health in Nigeria.
That's it. Theophilus, please let's both welcome our man Babajide Kolade Otitoju has joined us. Good evening, BKO.
Good evening, sir.
Yeah.
Good evening, sir.
Yes, sir.
I was just getting to know your statesman, Theophilus Abba. Jide, 24,000 doctors left in a country of approximately 200 million Nigerians.
Yes,
it's
a worrying development. The medical schools in our country produce between 3,000 to 3,500 medical doctors each year, including the private medical colleges.
Yeah.
Compared to India, that their medical colleges produce up to 50,000 a year. We are in a situation now by the rate at which the medical doctors are leaving.
Yeah, in our country.
We are not producing enough from those medical colleges, yet the rate at which they are leaving our country in droves is getting higher and higher, always higher than the previous year. So something drastic has to be done to ensure that we are able to keep these medical professionals and address the brain drain.
That's it.
On an incremental basis.
But let's start properly. This is what I mean. It is no longer a myth that many Nigerians find our country very frustrating. And so many Nigerians have jetted abroad as I speak. And this is by choice. The Nigerian Medical Association, NMA, says one of the most serious obstacles to the development of effective health services in Nigeria is inadequate supply of skilled human resources. This had led to serious manpower crisis in most health facilities in the country. Perhaps the alarming aspect of the story is what I just mentioned, is that there are about 24,000 actively licensed medical doctors caring for over 200 million Nigerians. This means one doctor to about 10,000 patients. Is the grass always greener on the other side, Jide?
No, not always, but for this kind of professionals, definitely they see opportunities that do not exist here. And this is a clarion call, a wake-up call to us to do our best to remedy the situation. We can get to that point too, where medical professionals want to stay here and work, want to earn their living, want to contribute to the improvement of the delivery of Medicare in our country. But the situation is there, and it doesn't encourage a lot of these professionals to want to stay here. 8 out of 10 medical doctors sampled indicated that they would want to leave Nigeria and go and work abroad. A situation in which the base salary for a medical professional in the UK is £4,000. You know, there's no way that people want to go there. Look at the value of our currency now. Look at even the cost of living. So, as long as certain things don't improve in our country, there is really nothing we can do about this. And this is the essence of this whole discussion. What can we do? I'm sure Theophilus and his team have done some studies that clearly show where the problems are, you know. So as patriots, our duty is to show what the problems are and nudge our
based
government.
on the info available
to us, and nudge our government to address this problem so that we don't get to a point in which the whole health system collapses.
Theophilus, a natural question to ask at this point is, when would you say this trend of health workers emigrating from Nigeria became so concerning?
Well, there's always been that movement from Nigeria to other parts of the world. And I want to mention that it's not just leaving Nigeria for other parts of the world that, we have discovered. Health workers no longer want to work at primary healthcare centers.
Within the country?
Within the country. They want to move from rural, health centers to general hospitals, and then those in general hospitals are always struggling to move from state-owned hospitals to federal medical centers. So you now discover that because of insecurity in some parts of the country, like Niger State, we studied in Niger State, we discovered that insecurity, made so many nurses and midwives to abandon rural primary healthcare centers. So we are not just talking about even leaving this country. Even access, for those in rural areas, having access to quality medical care is a problem. We have discovered that less than 50% of women who give birth had midwives, birth attendants to really actually attend to them. Less than. And then we discovered that, you see, the movement from Nigeria to other parts became more serious in recent years. For instance, in 2017, we had 26,121 male doctors and 13,791 female doctors. But as of 2019, the thing had dropped to 16,006 male doctors and 8,634 female doctors. Now, 2024, 2022 rather, sorry, we are now talking about only 24,000. As of 2019, we had more than that figure. But now we have only about 24,000 medical doctors in Nigeria.
Yeah.
So it's something that should be disturbing. And my worry is that, we are talking about 2023 elections, and specific issues like this are not being addressed. The issue of not having access to, medical doctors. You go to rural areas, that's when you feel it
Quality
much.
medical attention.
Yes, you get to rural area, you see somebody who has a chemist being referred to as a doctor. I went to the village 2 years ago, and I was talking to my uncle. He said he had pains in the body, and I said, okay, let me see what drugs you have been given. And I saw all sorts of mixture. I said, don't take this. He said, no, he's a doctor. I said, who's a doctor? He's the one chemist. Because he doesn't have access to...
What you call chemist is simply a patent medicine store.
Of course, So he now said, is this guy who gave me this? And even though I convinced him that, look, this mixture cannot be good. I'm not a medical doctor, but I don't think this mixture will be good for you. He didn't obey me. He just fell out. So far, that young man had told him that was what he should take. He just had to take.
Yeah. So one phrase that comes to mind is self-medication.
Self-medication, yes.
So it boggles the mind. So Nigerians should really be worried about this trend.
Yes, we really should be worried. All the signs are there that in terms of delivery of medical services, we are not where we should be. We talked about the primary health centers. Each of the primary health centers should actually have a medical doctor on duty.
Yeah.
But the truth is, in a lot of these primary health centers, is what you call auxiliary nurses, other categories of nurses that are actually taking charge. The doctors have left for the tertiary medical centers. And those tertiary medical centers are actually supposed to be even centers of research, centers of excellence, and centers for research. But because people have, because many doctors would rather not work in the rural areas, you can see that delivery of Medicare is actually suffering in those places.
Yeah.
So we need to...
Sorry, is it old school to talk about dispensaries at this point in 2022?
I don't think it's old school, as long as we keep medical professionals who can take good care of people in those places.
rural setting, yeah.
Yes. You see, people travel several kilometers just to be delivered of their babies. And in some cases, they experience stillbirth. Some even die while being taken to medical centers far away from where they live. We need to build more medical facilities across our country. Every ward, for example, every political ward should have a medical center, whether it is primary health,
or secondary.
Yes, you need to have, and where you have primary health centers, they must have a consultant or a senior medical practitioner who can attend to the
because
basic...
most of these health problems are avoidable.
Yes, a lot of what kills our people are avoidable, diseases that you can easily treat. But because people do not have access to Medicare, we lose them.
Theophilus, it's Nigerians would wonder what are the basic reasons that prompt health workers, especially doctors, nurses, and midwives, as he said, to want to practice outside our country.
Sir, the phrase that describes it appropriately is what we call brain drain. That is the classic case of brain drain. As at 2017, the number of Nigerian doctors practicing in the UK was 5,060. As at 2017.
And still counting.
Now, as at 2022, it has jumped to 9,976. I'm talking of medical doctors, qualified medical doctors. Then we talk about midwives and nurses. As at 2018, we had 2,796 midwives and nurses in the UK. You know, they were certified to work in the UK. But as at 2022, sir, we had 7,236 Nigerian midwives and nurses. So there's no other thing, I mean, there's no other way to describe it other than to say it is brain drain, classic sense of brain drain. Because these guys, you know, to get a medical degree is tough. If you train your child in a private university, you are spending a lot of money. Some universities are taking as much as 3 million, 3.5 million in Nigeria.
Per session.
Yes. And if the government trains one medical doctor in Nigeria that spend millions of naira, I think annually, I think about $1.2 million is spent on training Nigerian medical doctors. We graduate about 3,000 of these every year. But then, in spite of the fact that we have private hospitals, even governments are setting up universities of medical sciences. State governments are setting it up. Then we have many Nigerians who are going abroad to study medicine and they return. But then the number keeps decreasing. And the fact is that parents spend their resources, government spends a lot of money to train these medical doctors, but we allow them, you know, to go, to other parts of the world to, to practice.
Do you remember a particular minister who is a medical doctor said we had enough medical doctors in the country? Was it just bluffing?
Definitely. I mean, you mentioned it earlier. I mean, 24,000 medical doctors to treat 260 million Nigerians. We don't have enough. Actually, government has been talking about remittances. They say, oh, when these guys go outside Nigeria and they work, you know, they bring money, dollars to Nigeria. But the figures are not supporting what they are saying. As at 2010, you know, 5.50% of Nigerian GDP came from remittances. But as at 2022, it had dropped to 4.4% of the GDP.
Why?
So, I mean, because even when they get to those countries, how much would they send back? They have to live. They must survive. You must pay your rent. You must pay your tax. You have your family must pay that.
Taxes are high.
So, I mean, cost of that argument that when these guys travel out, they will bring money to Nigeria to develop this. It doesn't happen.
Yeah.
So,
yeah. Gidi, you know, they say statistics are no substitutes for judgments, but then 10,000 patients to one doctor is alarming. And what would you say is the implication of this?
Well, it's just clear that springing from this, a lot of our people will not have access to Medicare, and that is why people are losing their lives due to ailments that are easily treatable, you know, ailments that shouldn't take people's lives, you know. It's not in the rural areas, in the hinterland, for example. You find that there are not enough medical, not enough health centers, and where you have them, as I've said earlier, medical doctors are not available. They've gone to the tertiary, to work in the tertiary medical centers. So, because the conditions in the hinterland do not encourage them to want to stay. And the bulk of our population is in the hinterland. Not everybody can live in urban centers, you know. So, if it continues along this path, a lot more of our people will keep going down to ailments that are easily treatable because access to Medicare is not there. We must democratize access to Medicare. We must make it available to the teeming mass of our people. And the way to do that is to ensure that we build as many primary health centers as possible. Take them to the nooks and crannies of our country and ensure that at the apex of that primary health center is a medical doctor.
In charge.
Yes, that's the way it should be. Not a nurse, for example. Yes, we should have a medical doctor at the apex supported by nurses and other support staff.